actually used to smoke cigarettes. I started when I was around 12 years old. I found this new product called e-cigarettes, and I met a patient, a 17-year-old. He ended up having to get a double lung transplant because he had something called cigarette and vaping associated lung injury, or a VOLI.
I did a poll with one of my classes today. They're saying around 75% vape.
What would I tell teenagers who are thinking about vaping? Those who don't learn from history are deemed to repeat it.
Hello, I'm Brittany Tayler, host of TV5's Focus on 5. Today we welcome you to Genesee Health Plan presents Focus on Health, Students and Vaping. Genesee Health Plan is leading the charge in educating Mid-Michigan students and youth on the dangers of vaping. Today we have the opportunity to speak with medical experts, as well as student athletes from Carman Ainsworth High School, as well as their coach who share their thoughts on vaping. Let's dive right in.
My name is Donovan Hamlin. I'm a senior here at Carman Ainsworth, class of 2025, and I play football and basketball for the Cavaliers. And I've been playing football for 3 years, wide receiver and cornerback, and then basketball for a good 10 plus, I'll say that.
My name is Fred Thomas. I'm a senior, class of 2025. I'm a striker for Carman Ainsworth High School. Oh, I've been playing soccer since I was 9. I just like to get out and run. My goal is to go professional, hopefully get to the next level.
As an athlete, it's important because, the long-term effects, having lung problems, not having the best endurance, and just not being your natural self.
Vaping, it just kills your lung. It has a lot of negatives to your body. You need your body to be at 100% when you play soccer. Just because nothing may happen to you now, doesn't mean in the long term something may not happen.
But vaping, that's not the goal. You really want to play a sport and get somewhere with it, I would just advise not to vape, because in the long term, it's not going to work out well. Basically, the ones who want to take it serious and the ones who don't.
Jay Witham, I'm the varsity soccer coach, varsity basketball coach, and also the athletic trainer here at Carman Ainsworth High School. I thought for sure it'd be more around, 15%. And I did a poll with my soccer team yesterday and a poll with one of my classes today. And the numbers that they came up with were way high compared to what I thought it was. And that's coming from the peers. Like Hawk right here, he just said it was probably about 45%, and some of the kids yesterday were talking more around the 60%. And that just blew my mind. I didn't think it'd be that high among athletes. Among the population of students, it's even higher than that. They're saying around 75% that people vape. It's just, it's a simple fact that they can hide it so well. I mean, I know what the outcomes are from vaping. I know it takes the oxygen-rich blood from the lungs and the muscles, which is going to deplete your performance. With these athletes, we're just touching on the short-term stuff, as far as respiratory, cardiovascular, even neurological. The first thing was popcorn lung when it came out. Now there's so many, and I read something that they haven't really done a serious study because vaping has only been around since 2007. And so there's not really a longevity study, for the long-term outcomes. These kids don't understand what's in it. They don't know that nickel's in it, chromium's in it, formaldehyde's in it, lead, and being in the Flint area, with the lead crisis, that should trigger these students to stay away from it. And I think it actually needs to be taught to them what is in it and what are the outcomes of vaping. Hopefully that'll help, but something's got to change. It's scary. It's definitely scary, and they don't understand it. They think they're invincible.
Thank you to Donovan, Fred, and Coach Witham for sharing your thoughts today. Coming up, we speak to medical experts who have some incredible stories that will inspire and educate. We'll be right back for more Genesee Health Plan presents Focus on Health, Students and Vaping in just a moment. Welcome back to Genesee Health Plan presents Focus on Health, Students and Vaping. Next on the program today, we get to know Dr. Brittany Tayler and Dr. Bara Zuhaili, who both have incredible stories to share that will inspire and educate. Let's go ahead and meet these experts.
My name is Dr. Brittany Tayler, and I'm an internist and a pediatrician, which means that it's a fancy way of saying that I take care of both adults and kids. And I work here in Flint, Michigan. I work clinically at Hurley Medical Center, and I do research around tobacco and cannabis here at Michigan State University.
My name is Bara Zuhaili. I'm a vascular surgeon at Michigan Vascular Center in Flint, Michigan. People ask me often, why is it such a big deal for a teenager to take few puff or few smokes or vape here and there? What's the big deal? The answer is very, very complex and goes in multiple layers. Let's start with the most immediate effect. So for any teenager who's taking few vapes here and there are so many studies that show that even their immediate performance, even as little as doing push-up or doing single lap run around the field, that is significantly reduced and hampered by vaping. So even in the immediate effect of vaping, there is a significant deterioration on the school kids with vaping.
They had a lot of studies that have shown that folks who play sports, organized sports, are actually more likely to use e-cigarettes, which is very alarming because a lot of times we've always thought about folks who use cigarettes or other tobacco products as most of the time people who are not as engaged with society and not playing sports. So it's very alarming that someone who is playing a sport is actually using this product. Not only because, again, that's not something that we traditionally see, but also because a lot of that we believe is driven by sports figures, especially in the media, using these products. And kind of on the reverse side is that we've seen a lot of negative health effects, and even just then, like in real time, negative effects on the athletic performance of individuals who are using those products. So they actually came out with a study in early 2020, which took U.S. Army recruits. So these were all 17, 18, and 19-year-olds, young individuals. You get recruited into the U.S. Army, you have to run 2 miles, you have to do a number of sit-ups and push-ups, etc. with this. And they asked them during that if they used cigarettes, if they used e-cigarettes, or if they used both. And they found that folks who used e-cigarettes ran the mile slower, did less push-ups, and did less sit-ups, even than those who smoked cigarettes. Those who used both did worse than both of those groups as well. And so that is only after a couple years of use. So even if they started at 12, 13, 14, those are only 4 or 5 years of use of these e-cigarettes. We're already having clear negative impacts on their athletic performance. Not only that, but if someone has asthma or any sort of lung disease, this can cause increased exacerbations and decrease their athletic performance with that as well. If anyone gets any sort of surgery, including knee surgeries, they have poor wound outcomes and poor healing from that. So if you tear your ACL, your MCL, anything like that, you're much more likely to have poor or longer term complications and not be able to return to peak physical fitness after that if you are using an e-cigarette. So lots and lots of long-term outcomes, even from short usage of e-cigarettes. So that's been a lot of the work around that. Has just been learning and providing education, making sure that we're screening for those sorts of things, both in pediatrics and in adult populations, and learning about what the short and long-term effects of e-cigarettes are. We might not have all of the information, but we have enough to make an educated decision on whether or not our children should be using this product at this point.
Thank you, Dr. Tayler and Dr. Zuhaili. Next up, we speak with our experts about how the vape industry targets youth and the struggle for teachers and coaches to keep vaping out of schools. We'll be right back with more. Genesee Health Plan presents Focus on Health, Students and Vaping right after this. Welcome back to Genesee Health Plan presents Focus on Health, Students and Vaping. Next on today's program, we speak with our medical experts on how the vape industry targets youth and the struggle for teachers and coaches to keep vaping out of schools. Let's get to it.
Vaping started to become a social trend starting in 2016 and 17, where it became acceptable to see celebrities, sadly, role models for our kids, smoking and vaping specifically. You could see it on social media all the time. And there are studies that showed the trend, how many times the word vaping was mentioned in social media, and you can see the skyrocket coming from 2017 going up, where now it became perfectly normal for someone as young as 14 to show him or herself vaping on social media. When it comes to flavoring, they are throwing all different flavors at our kids. And again, our kids don't know any better. They see something that is flavored like strawberry or apple or chocolate. How are they able to resist that? They make it sound almost like those flavors are healthy and good for you. And there's nothing healthy about them. There's nothing good about them. But still they use those flavors with all those enticing names and packaging material that make it sound very interesting to them. Unfortunately, the way those products are being available commercially, it's really not making it any easier for our youth to handle that. The industry is literally kind of using dirty maneuvers to trick people and like, oh yeah, it's all safe. Look, it looks like a whipping cream or like a candy. This is unethical. I know how they allow that.
E-cigarettes come in a lot of different shapes and sizes, and some of them can be very subtle. They're intentionally done so to be very discreet. So a lot of times they'll look like a USB. I think that's one of the classic ones, but they also have ones that look like food items. So they can look like different bags of candy. There's also ones that look exactly like highlighters, which is terrifying. They actually have the same writing on it that looks exactly the same. So it can be very subtle. There's also certain backpacks and water bottles and different things like that that they can use, as well as hoodies that they can put an e-cigarette in and use and be very subtle. So they can have the hood up, go like that, or in a sleeve, or in one of the water things. So there's all sorts of different subtle ways, and these are all sold on Amazon. So these are very easy for kids to get as well. And I don't want anyone to believe that that it's not easy for kids to get online. It's also in person. We unfortunately don't have super great regulations here in the state of Michigan around that to kind of stop individual youth from going and buying. The Department of Health and Human Services last year actually did a survey, and they asked youth in school how they got their e-cigarettes, and almost all of them got it from directly buying it from the stores themselves. And they also didn't have a concern that they would be stopped or carded, and so it's very easy for them to get that. So I don't want parents to believe that just because they're not buying it for them or they're not seeing it, that doesn't mean that they're not using it. This is a huge issue for a lot of the schools, and a lot of them are trying to do different things, whether alternative suspensions, fines, dealing with resource officers, etc. with this. So this is a constant issue that teachers are feeling, administrators are feeling, coaches are seeing as well, and it's very difficult for them to deal with just because a lot of these kids are addicted.
Thank you, Dr. Tayler and Dr. Zuhaili. Next up, we speak with our experts about addiction and how the effects can be amplified with young individuals as they develop. We'll be right back for more Genesee Health Plan presents a Focus on Health, Students in Vaping, right after this. Welcome back to Genesee Health Plan presents a Focus on Health, Students in Vaping. Next on today's program, we speak with our medical experts about addiction and how the effects can be amplified with young individuals as they develop. Let's get to it.
Unsurprisingly, like with a lot of people who do this work, it's personally affected me. I actually used to smoke cigarettes. I started when I was around 12 years old. And even though I knew it was bad, it was just something that a lot of people were doing. It really helped me focus during school and to get through a lot of my classes, especially going into pre-med and then medical school. Eventually, when I was a resident, so a physician in training, there was really long hours, and so I didn't have time to leave the hospital to smoke. And so I found this new product called e-cigarettes, which were awesome. It was really easy to conceal. You couldn't smell it on me anymore, so my patients couldn't smell it, and I could smoke out the window very easily. And I was actually using those products during my first year, and I met a patient, a 17-year-old boy, during one of my early years of training, and he ended up having to get a double lung transplant because he had something called e-cigarette and vaping associated lung injury, or a VOLI. And even though I had tried to quit multiple times before, that was the first day that I quit cold turkey. And that was really striking to me because I didn't realize how bad it was. So a big thing that I always am concerned about, and as someone who used a nicotine product as youth, we know that nicotine affects the adolescent brain a lot differently than it affects an adult brain. So actually this region of the brain called the prefrontal cortex, which is right in the front of your brain, which doesn't finish developing until age 24 or 25. And that part of the brain is really what is kind of the brake for the rest of the brain, the impulsive side of the brain. It's also the part that helps us make long-term decisions and complex kind of weighing the benefits and risks of something. And it's very, it develops during teenage years, and so that's why you might have a 12-year-old who can't make a super long-term plan, but a 16 or 17-year-old can make a plan about college. And unfortunately, the way that nicotine affects that part of the brain, because it's still developing, can actually hardwire an addiction into that. It can actually make that as part of one of the long-term kind of plans that the brain wants to focus on is nicotine. So it actually is much easier for an individual during that age because of that easy way to manipulate the brain at that stage because it's still developing. So you can actually, again, hardwire a nicotine addiction into that developing brain. And that's, again, why we don't allow for folks to use tobacco products until they're 21 or drink alcohol until they're 21, because we know that that part of the brain is still developing well into that period.
People often ask, why is nicotine bad? Well, let's start by what is nicotine. Nicotine is the main component of cigarette and vaping at the same time. Nicotine itself is highly addictive. And just to give you an idea of how addictive nicotine are, studies have shown 7 out of 10 patients, 7 out of 10, so majority of patients want to quit smoking and vaping, but they cannot do that. That's how addictive nicotine is. Nicotine does that by accelerating your heart rate, your blood pressure, so it gives you the kind of fake feel-good feeling about it. But also with that, it comes with significant damage to the lung and to the arteries. Me as a vascular surgeon, I see the significant damage of nicotine on a daily basis. Almost 90% of my patients are either active smoker or previous smokers / vapors. It causes significant damage to the arteries where it literally shuts down the arteries, and it causes significant symptoms because of the lack of circulation.
Thank you, Dr. Tayler and Dr. Zuhaili. Next on today's program, our medical experts will explain what EVALI is, as well as other health risks associated with vaping. Stay tuned as Genesee Health Plan presents Focus on Health as Students in Vaping returns after these messages. Welcome back to Genesee Health Plan presents Focus on Health, Students in Vaping. Up next, our medical experts explain what EVALI is, as well as other health risks associated with vaping. Let's hear what our experts have to say on the subject.
There are so many studies that detail the immediate death and lung injury that happened with vaping. So back in 2020, before COVID started, the CDC published a report where 68 otherwise healthy kids died from something called EVALI, the e-cigarette vaping associated lung injury. 68 otherwise healthy kids died from that. More than 2,800 people have suffered significant lung injury because of vaping that led to their hospitalization. Unfortunately, those numbers have stopped being reported because of the COVID pandemic. But just over 1 year, we have 68 deaths, almost 3,000 hospitalization because of vaping. EVALI did not even exist before the spread of vaping. So even with all the years and research that came with cigarette smoking, EVALI document different kind of lung injury that is happening only with vaping. So usually kids who are, again, otherwise healthy, people who has never had any disease before, suddenly notice difficulty breathing, suddenly notice pain, chest pain, suddenly notice their ability to do basic stuff are significantly decreased. And very often those kids end up in the hospital for a significant number of days, some of them as long as 6 weeks in the hospital just because of vaping.
And we still do see a lot of other lung injuries that can happen from using e-cigarettes due to the different components of it. And so EVALI is just one of them, is one of the issues that can happen from that. It can cause extensive scarring that's irreversible in the lungs, usually due to a different component of it. Not actually the nicotine itself, but some of the flavoring components, as well as some of the additives, basically, to the e-cigarettes. So it can be exceptionally harmful, and that damage is irreversible and can be life-threatening because of that.
And maybe this is one of the scariest part about this idea of vaping. Now with vaping, we're coming up with new acronyms, with new diseases that we haven't encountered for the last 4 years of our battle with nicotine and smoking. So we all know about all the damage that nicotine and regular cigarette causes. Well, guess what? Now we have a new disease that we haven't even knew it existed, and it only happened with vaping. Not all 7,000 toxic material that exist in cigarette exist in vaping. That's the good news. The bad news is there are more toxic materials that we haven't even know they exist. So recently, Johns Hopkins Medical School of Medicine released a study in October of 2021 where they identified new toxic materials that exist only in vaping that didn't exist in cigarette. Out of those materials, there are 3 materials they didn't even know what to name them. They are literally actively working on finding a way to identify those toxic materials. Just like cigarette, we thought nothing out of it, and now we know how bad it is. Unfortunately, we're doing the same with vaping now.
Thank you, Dr. Tayler and Dr. Zuhaili. For the final part of today's program, our medical experts discuss the subject of quitting vaping, including how to approach the subject with your kids. Genesee Health Plan presents Focus on Health, Students in Vaping. We'll be right back. Welcome back to Genesee Health Plan presents a Focus on Health, Students in Vaping. For the final part of today's program, our medical experts discuss the subject of quitting vaping, including how to approach the subject with your kids. Let's listen in.
It is never, never, never too late to quit and to reverse the damage that's happened. There does get to a certain point after 20, 30 years where the damage might be irreversible, but there's always a benefit. Even 1 week after quitting a tobacco product, there are changes in where the heart and the lungs work that start to revert back to pre-tobacco use. And so there is always a benefit. In 5 years out, you almost half your risk of heart attacks and strokes if you've quit a tobacco product. And by 10 years, you return to your normal risk of those other long-term consequences. So no matter what, there is always a benefit. Even my individuals who are 60 and 70, there's still benefit to them in the way that they feel, the way that they breathe, and their long-term health outcomes, even with quitting. One of my big slogans is you never quit quitting, you just keep trying. As someone who took 6 times to quit, I completely understand that it might not be the first time, it might not be the second or the third time, and sometimes quitting is going to look a little bit different from everyone, and not to get discouraged that even cutting down has benefits as well. And there's lots of different techniques, tools, tips, tricks to make this work, and we have lots of resources and supports to help someone through this as well. So not only can we do nicotine replacement, so that's giving back the nicotine in a less harmful way to help with some of those physical and psychological cravings with that as well, but there's all sorts of different tips and tricks and techniques that we can use in order to help someone quit smoking. And a big thing I always tell parents about when they're trying to talk to their kids about this, as well as so many other things that happen in school, is to open the conversation and be genuine and be authentic with them. And this might take several times to get to that point. A really easy opening that I always ask them to do is like ask about their friends, if they see a billboard, if they see an ad about something, to open the conversation then kind of casually. Sometimes I ask them to talk about the health harms coming from there with their students. Like, I know you're playing football this year. I wouldn't want anything to jeopardize that. Do you have any concerns about like your lung health? I've heard about these vaping products. A lot of kids are using them because they have a lot of stressors, whether it's at school, sports, just life in general. It's hard to be a kid. We talk about mental health and kids right now being so difficult. And a lot of times they're using it to deal with something like that. And when a parent opens up that conversation with that, it can be really renewing and can really foster that connection between the two and a support system for that kid as they're trying to quit and also trying to find other ways to cope with the stress that they're having.
What would I tell teenagers who are thinking about vaping or actually vaping? It's simple. Those who don't learn from history are deemed to repeat it. Unfortunately, we've learned a lot the hard way about smoking. Years and years of smoking has shown us how much damage it can do to us. And now the same thing is about to happen again with vaping. Please don't repeat the mistake that my generation and the generation before me has done.
Thank you for joining us for Genesee Health Plan presents a Focus on Health, Students in Vaping. We want to thank Dr. Tayler, Dr. Zuhaili, Coach Witham, as well as Donovan and Fred for being part of today's program. And of course, Genesee Health Plan, TV5, and everyone who helped make this program possible. Thank you.